Hello, everybody. My name is Professor Giles Mohan, and I'd like to welcome you to the first of these webinars on researching under COVID. I'm based at the Open University. I'm a Professor of International Development. I'm very excited to be chairing today's event. We've got a fantastic lineup of speakers to talk around the issue of how we do research with mobile populations in a time of lockdown. Personally, I live in Leicester, in the middle of the UK, and we've just been under a new lockdown, so my mobility is also very constrained, but we've all got used to this kind of format of meeting and talking to each other, so looking forward to the next hour and a half. I'm just going to introduce the topic a little bit and then introduce the speakers and give you some sense of how we're going to run the session. I mean, clearly over the past few months, with the spread of the pandemic, it's raised a whole set of questions about how we do research, how organisations such as NGOs who work with mobile populations access information about those populations in ethical ways. How do we adapt the methods we've become accustomed to, whether it's surveys, questionnaires, etc., and then what ethical and safeguarding issues does that raise? I think these are really fascinating questions. The fact we've got so many people signed up, and welcome to you all, is probably testament to the fact that a lot of people are thinking, worrying, working with these kind of questions. On top of that, I think mobile populations themselves are particularly vulnerable in these times. We know that access to healthcare, living in crowded camps, lacking the citizenship rights, and all this kind of coming together of a whole set of factors renders those populations more vulnerable arguably than most. So across West Africa and Central Africa, we've seen the pandemic beginning to spread. We have massive mobilization of humanitarian response, albeit from with under fairly straitened conditions. The big UNHCR and other organizations are scrabbling around now to try and catch up. So what we wanted to do today really was to bring together both researchers, practitioners, practitioner researchers, researcher practitioners, whatever title we want to give them, who work at that interface between delivering support in those communities on the ground, but also doing academic and policy-based research on top of that. So I'm going to introduce everybody in a moment. Obviously, this is a slightly odd situation where you can see and hear us, we can't see and hear you, but there's lots of ways in which you can post questions, and I'll explain a bit how we're going to try and run this session today. So if we're on Microsoft Teams, I hope you're all there. If you look along the bottom, there is a Q&A icon, which is two little squarish speech bubbles with a question mark in it. I've got the Q&A feed open, so if you want to post a question, I then will put that to the panel or panelists, whoever, if it's a general question or a specific question. You can also get in touch with my very excellent colleague Heidi McCafferty. She is on our Twitter account, which is at @intdev_OU. I think that will be put up into the Q&A panel as well, so you can use that. She will then sort of triage them and send them on to me. You can also email her directly. She's emailed you on a number of occasions in advance of this, so you can just use that Heidi.McCafferty email. I have to let you know that even though we can't see you, we can't hear you, we are recording this event so we can then post it onto our website. And yeah, so you'll get an email at the end of the event about where you can see that, but rest assured, there won't be any ability to identify anybody from that recording. And I've just noticed Heidi's now posted the Twitter handle on the Q&A bar, so that's good. Before we get going, I just wanted to thank Heidi herself. She's been excellent. Her son is helping. You can't see him, but Finn is also fielding stuff, and Craig Walker's also been very instrumental in organising all of this. Unfortunately, Craig's got some family bereavement, so unfortunately he can't be with us today, but thanks to him. So I'm now just going to briefly introduce the four speakers that we have today. As I said, exciting mix. Four speakers. First, we have Margaret Ebubadike, who is currently based in the Open University, but has worked across across northern Nigeria using community-based participatory approaches to looking at empowerment of young women and girls. Her research at the moment is focusing on that access, about how the retention and completion in education, how we can deal with questions of gender equality, and how questions of local culture play into that access question, and also questions about income. So a kind of very intersectional kind of approach to how you do and increase access to education. So delighted to welcome to Margaret. Secondly, we have Melis Jin, who is a lecturer in Lancaster University, who I know has collaborated with colleagues at the OU, but she works on education and social justice, particularly on the relationship between education and international development, and has been working on some really fascinating projects, I know, on kind of how you look at peace building in post-conflict situations using arts-based methodologies, and how you can kind of incorporate a much more gender sensitive and gender empowering approach to that. So yeah, we welcome Melis. Then we have Tommy Olaniyan, or some of you know her as Christine, who is the director of PADEAP, that's the Pan-African Development Education and Advocacy Programme, and also founder of ILERA, which is a community health initiative. And I think PADEAP mainly works in Nigeria and in Uganda, but with local partners, and looking at a whole range of kind of support for refugee communities around training, health education, rights, advocacy, psychosocial support, etc., as well as healthcare, looking at questions of violence against women. And I think, you know, I don't want to classify her research in any kind of glib way, but kind of it rotates around kind of decolonizing approaches to community-led research. So delighted to welcome Tommy. And finally, Felicity, who I work with personally on a research project, but she works for the African Migration and Development Policy Centre in Nairobi in Kenya, and has been part of this Migration and Inclusive African Growth project that I lead at the OU, but we have fantastic partners over there in Kenya, and Felicity is brilliant. She's also a PhD student focusing on kind of intercultural relations in between refugee traders and kind of the host community in Kalabaye settlement in Kenya. So again, an active researcher, but also working in a policy context. So those are our fantastic panel today. The way we're going to run it is we've got four big topics I think were prefaced on the emails you've received. The first is around ethical considerations and questions when we're working with vulnerable communities during the COVID pandemic. The second theme is around the implications for participatory approaches and our responsibility to the participants in those kind of engagements. The third question is around, then linked to that, how do you access participants during lockdown? Again, an issue I think a lot of us face. I certainly have faced it in my research. And then we're going to finish with a question around, you know, the gender dimensions of research, and how does remote research raise particular issues around the gendered dynamics of all of this. Because we can't be sort of totally interactive, we're going to try and run it as a bit of a round table, a kind of discussion, but we're going to go through those four topics one by one. You'll have a chance then to ask questions during this as they speak, but formally I'll try and feed those questions in when the speakers have stopped. So they're going to sort of talk for a few minutes. We're going to try and make it as conversational as possible, and then you have a chance to raise those questions through those means. And then once we've exhausted that one, we'll move on. So we're going to try and keep to time if possible. Without more ado, I think that is everything. So again, welcome to everybody. Get your ears and eyes open, and we will first of all discuss questions around the ethics of working with vulnerable communities. So there was a bit of a tussle, which I don't know how it was resolved, but I am now going to abuse my chair's position and ask Margaret to speak first. Sorry, Margaret.
Yeah,
on this topic. Thank you.
Yeah, thank you, Giles. Yeah, thanks for the introduction. Hello, everyone. Yeah, I think from my experience, the first concern is about the well-being of your participants. You should take priority over your timelines or your deadline as a researcher. You should have their well-being as your utmost concern. And from my experience working with IDPs in Northeast Nigeria, what I've done really is to ensure that my research is not putting additional pressure on my participants. Now, looking at the IDPs in Northeast Nigeria, for me, they're experiencing what I call a double pandemic. They've gone through the insurgency, and then it has actually affected their finances, and some of them have lost their jobs, their homes, and then the COVID-19 pandemic has added another layer to their difficulty. So asking them to partake in a research at this moment, you're going to be asking, is it actually ethical? Are you exploiting them, or is it just about your benefit? How about their own well-being? So what I've done in this instance is I've used WhatsApp for collecting data, and I try as much as I can to provide mobile data for my participants. I provide their mobile data, which actually encourages them to participate, in as much as it doesn't really take away the stress or the pressure, but at least it's giving back something to them. And then I've actually tried to respond to ethical issues, trying to mitigate the risk by using what I call community-based research assistants. So these community-based research assistants, they live in the community, they understand the community, they understand the dynamics of the community. So they will be able to generate data in a way that is sensitive to the experience of the people in that community. The danger there is that the participant might not want to actually open up to someone they're familiar with. They feel, okay, if I tell you everything about me, you're going to use it against me. So what I do usually is to allow the community-based researcher gather as much data as he or she can, and then I follow up with my interviews over the phone or WhatsApp or which other means I use, which is actually keeping with the social distancing rule. So in a nutshell, like I said earlier, the main contention here is to ensure that your well-being of your participant takes priority over any deadline, over any timeline, and try as much as you can to also use community-based researchers, because they're the ones who hold the power to getting data that is rich and thick for this during this lockdown. Because to be honest, you couldn't assess your participants much better than someone who is in that community. And then using community-based research assistants also is useful to the community, because you're putting money in someone's pocket, you're putting food on the table for a family. Like I said earlier, the IDPs in Northeast Nigeria, they've lost their homes, they've lost their jobs. So using a community-based researcher means I'm paying the community-based researcher assistant, and then actually solving a financial problem for a family in that region. Thank you, Charles.
Okay, thanks a lot, Margaret. So interesting questions there. I think a number of issues raised around the burden of research. People are already burdened and stressed, and we have to, I think about how we do research in a way that doesn't add to that burden. So thank you for that. I'm now going to invite Tommy to come up and speak next. Thank you, Tommy.
Hi, good afternoon, everybody. Thanks, Margaret. I think following from your few points, I think at this time, can you hear me? Yes.
Yeah.
Okay, sorry, yeah. I think at this time, as we've been saying, with many different aspects of COVID, pre-COVID, and the current issues around COVID is, what is the new normal? And I think with research, again, that is, I think for me, a question we need to kind of step back and look at that and look at the reframing notions of traditional research. I think if COVID and this particular time is not a chance for us to really look at that, then there's no other time really. And I think for me, that goes back to, as Giles mentioned, looking at research from a community decolonial focus and what that really means. And with my work in both Uganda and Nigeria, that has really looking at equitable community engagement. What does that mean? And what does it mean for research? And I think that question needs to be asked at all levels. Like the work that we're doing with Melis, looking at arts research methods and work in refugee settlements and IDP camps. But how do we engage the most vulnerable, and how do we ensure that their voice is being heard? And I think with COVID now, there's a lot of talk about going to, like Margaret mentioned, going to use WhatsApp, going to use remote methods of working. But actually, does that then create more of a distance? I think we have to go back to really looking at the planning around research. I think that then asks the question of who is the research for? For me, that has to come first, and that needs to come at all stages of research applications, of research method planning, So looking at needs assessment, the planning, the research intervention design, implementing, evaluating and disseminating to the communities where you're doing the research. And I think, okay, COVID will bring up a lot of issues regarding that, but we have to go back to basics now and say, okay, how do we do this ethically? How do we do it putting the participants first and ensuring the research that comes out is for the benefit of those participants, not for the benefit of the global North institutions, which, let's be honest, that's where the majority of money comes from for research. And for me, that is where also where equitable research needs to look at in terms of the power dynamics, where how do we ensure that global South universities and Southern-based universities and researchers have an input into research design, into the participants that we're working with. And we know now that in terms of migration and refugee populations, it's a highly demanded area for research. But yet, as Margaret mentioned, these are the most vulnerable groups. And we have to make sure that research will get back and the policy changes will lead to their improvement of their lives and not just documents that very few read and very few access. And that also goes back to who is researching, who is publishing, who is, you know, where is this work being disseminated to? Is it getting back to the countries where we're working? These are all the kind of questions that I always think of, which does fundamentally look at power, looking at mutual relationships, co-learning, capacity sharing of expertise, which is vital for research to really be ethical for me, and in these difficult times, these are the questions I think will enable us to really look in a kind of with a decolonializing lens and also a real community-based approach to research.
Lovely, thank you, Tommy. Again, fundamental question really about who's going to benefit from all of this, and I think we can get in the rush to kind of get into the research, we often forget that very profound and fundamental question, speaking personally possibly. Lovely. Felicity up next. Thank you, Felicity. You're live.
Oh, hi. Currently, as Giles already mentioned, I'm conducting field work for the Migration and Inclusive African Growth Project, and one of our target group has been small and medium enterprises, particularly immigrants who are embedded in this in various sectors in these areas. And one of the challenges, one of the ethical dilemmas that we've had to encounter as researchers conducting fieldwork at the moment is the fact that the people we are targeting have been adversely affected by COVID. Some have had to close their business down, some have lost customers, and we have to ask them. I mean, the research design as is and the tools that we're using were initially designed before COVID, and the questions that we are asking are about their businesses. How's your business? I mean, like, how many people do you employ? What are the benefits of this business to the country, to Kenya? And some of these questions that ideally are very hard and tough to answer now without really bringing in COVID. And it's been a challenge really trying to remove COVID from the responses we are getting. And at a very personal level, I've had to decide to make this personal decision to listen to them. Of course, we decided as a consortium not to include COVID as one of within the tools, but I've found it really hard not listening to them and not really just setting aside time to listen to them when they say, oh, well, this is my business, but at the moment, COVID has really made things difficult. COVID has affected my business. Of course, it will not be included in the overall analysis of the data, but I think I owe them, or rather we owe them an ear, right? Because they're mentally affected by the pandemic, and the most you can do as a researcher is just listen, right? To give them that closure in this sense. But also it's important to know that the country is currently opening up, and more things are getting better, and the next step will then be to go out to the field, right? Because most of them are embedded in the informal sector, and these are open markets where social distancing will be a challenge, and as researchers will need to go out there and collect this data, and personally I'll need to go out there and collect this data, and there's a fear that, okay, I'm going out there, but will I be carrying with me the virus? Like, will I be getting the virus from the field, you know? So there are questions as regards, do we go out there and provide them with PPEs as we are conducting, as we are collecting data? Will we be carrying with us hand sanitizers while we collect the data? How much distance can we really keep when these are crowded markets? At the moment in Nairobi, most of the major markets currently are very crowded. And beyond this, the issues of consent, of course, and at the moment, people want, as I mentioned, people want to open up, right? So there's that fear that they are talking to us because they feel like it's a way of release, but at the same time there's that hope that somehow the research will make things better for them, will improve their situation. So we're finding it hard explaining to them that, or rather I'm finding it hard as a researcher explaining to them that, of course, I want to listen to you, and you're giving me consent not just because I'll help you in a way, but because this research is for a larger purpose, like it has a larger policy purpose, right? So how do you tell them that you're participating in this research, not because it will immediately help you improve your situation, but it will take a longer period to actually have policy implications? This has been quite a challenge because you tell them, are you willing to participate in the research? And the first question they'll ask you is, okay, how am I going to benefit? Like, how's my business going to benefit from this research? Like, in light of COVID, you're asking me about my business, you're asking me about my profits, the profits I get from this business, you're asking me about how many people I'm employing. It means that you aim to get something from it, but what am I getting from it? This has been quite a challenge for us. And still grappling, personally, I'm still grappling with the fact that I feel that sometimes they agree with the hope of immediate benefit and not because, well, they're giving us consent for the sake of giving consent. I don't know if I make sense. Thank you.
Okay.
Yeah.
Thank you very much, Felicity. Yeah. I mean, I think, yeah, it's very sobering, really. I mean, I think the issue about what benefits participants get has always been there, but I think from what you're saying, it's become intensified under this current crisis of, you know, increasing precarity and uncertainty about the future. And I think that then obviously raises even higher the kind of question about, so why are we doing this and what benefit? And I mean, I think that's a big challenge. So I'm going to turn finally now to Menace before we open for questions. Thank you.
Hi, everyone. So thank you very much for the speakers. Actually, we all approach ethical issues from different perspectives. Margaret and Felicity talk about the importance of, like community aspect, importance of knowing the local communities and really giving a critical thought about how they can benefit from the research that we're doing. And Tommy has focused on the ethical issues regarding the institutional research cultures, that was a sort of a call for, decolonizing the research cultures between global north and global south, actually, and taking into all these ethical issues into consideration. And the way that I will, approach the ethical issues will be more from a practical stance, and we'll touch on a couple of points that I've come across as I worked over the past 5 years with vulnerable, mobile and rural populations across Africa and Turkey. So one of the issues is that ethics starts well before we start the research. So ethics starts actually once you get the grant, and before you start your research, you have to really think through it, and you have to include your community partners, the NGOs, and the people that you will be working with. So this is the most important aspect. I mean, over the last 2 or 3 years, I've been collaborating a lot with Tommy, and she's been one of the key people, the NGOs that have been working across a number of contexts, and we were always in a kind of a collaboration where we think about the ethics, because you need to contextualize your ethical issues or ethical standards. And one example of is that with vulnerable populations or mobile populations, one of the issues we come across is that they are, for example, very they're not really very much enthusiastic about signing a consent form, which is a piece of paper and outlining, what they are giving consent to. So in that cases, for instance, we have to more use like oral consent forms, and that's what we have been doing over a number of projects, where we're actually taking oral consents, explaining them, and making sure that if they're not speaking the language or of the dominant language, then we are making sure that we have interpreters that will explain them, through the procedures and what they are, signing up to. So the second issue that we need to consider is the counselling. So on a number of occasions, that was came as an an issue. I wouldn't say an issue, but something that I needed to address in my research as well. Although working with vulnerable populations, or mobile populations, or the populations who have been forcefully displaced, and all these process of doing interview or doing community participatory action research or whatever, or art-based or participatory arts work, it's very possible that some of the previously experienced trauma might be triggered. So it's very important that we have psychological counselors on site, and that was one of the issues that they were come across in one of our research. And of course we had a psychological counselor, and then we had to interrupt it, sort of stop, give a sort of a break to the interview. It was a focus group interview, and then we just took that woman to one of our psychological counselors who was on the side, and it's really important that you're not actually causing more damage to your participants, and you have to think really all the issues beforehand. And it's the same with legal counseling as well. You have to make sure that you have, or your NGOs, your research partners, or the universities that you're working with has the legal counselors in place to interfere in case of there's a physical and a sexual assault that they're facing, or a physical threat to their lives or livelihoods, because as I said, these are very much populations who have been forcefully displaced and find themselves in very unwelcoming environments. But not all of them, but most of the time that is the case. And I think the other issue that I would like to mention is the paying for the participants' time. I mean, most of the time I know that there's a research culture changing towards more acknowledging the time of the participants, but it's really important that at least we offer something back to the communities, and NGOs are very much actually aware of this, and that also comes as an issue in the ethical sort of design of the research. So most of the time these vulnerable populations are involved in a casual work, or they are in informal markets. So if they're not working with you on that particular a research project, probably they will be going and working elsewhere trying to make an income. So it's really important that we somehow either pay back to the community or pay for the times of those participants. And the other issue, the final issue that we have also come across, and I would like to highlight, is that creating safe spaces for this kind of research. I mean, if you're doing a community research and so on, you have to really think about how you can mitigate the risks of conflict. But this also applies for, for much more individual interviews that you are running in communities. For instance, one of our projects, I am only interviewing women to understand the peace building aspect of this gender dimension. So how we can integrate women as peace builders into community. And I'm very much aware that this may agonize some men in the communities and may further, increase the conflict. So the important thing is that actually we create safe spaces, maybe, spaces to interview them outside their communities, and that could be the premises of NGOs that we're working with. But there's, lots of dimensions that we need to take into account as we, go through the research, especially with these populations who might be, find themselves in intense conflict.
Okay, excellent. Thanks, everybody. So we now have a little period before we move on, although some of the issues that we've already raised are going to, this is a kind of flowing conversation, so we can pick those up again. But I do have a question from James. Thank you, James. So James is about to start some research about recently arrived migrants into Europe, and it's a project that's been commissioned by a number of partners, and the big issue is about this issue of payment of participants. So the debate seems to be between, if you are giving undue inducement to participate in the research if you pay people, versus, well, there's obviously burdens of financial burdens from participating. I mean, so he's asked, could the four panelists reflect on the question of payment for participation? I think it was just picked up there by well, Tommy and Melis, but can I ask Margaret, have you got any thoughts on where, this question of payment? Obviously, people's time is precious. They're already under stress financially, emotionally.
Yeah, I think payment of participants, really, particularly in low-income countries, is a yes, because they already have been through a lot of, like I mentioned in my IDP situation with the camps, they've actually lost their source of income to insurgency already and to armed conflict. So you're asking them to participate in a research which is being funded, and you've got some money for it, and you're not paying anything in return. It's actually it's like exploiting them, because they've lost their source of income, they've lost their homes, and then you're saying, can you provide me with data to enrich my own research? So what happens to them? Okay. That's the question. What happens to them? Yeah. So are they going to be say, okay, yeah, that's the response you want. You go away with the data, you do what you want to do, and then you left. It's exploitative. So yes, the participants should be paid, particularly in situations where the participants are living beyond poverty level. Thank you.
Yeah. Seeing lots of nods. Tommy, do you want to jump in?
Yes, I mean, I reiterate that, and I think it goes back to, we have to also look at the applications, look at the proposals we put in, and recognise this from the start. Sometimes, we didn't budget for it. Well, you budget for salaries, you budget for your, the research assistant salaries. Participants' costs should be the first thing for me that goes in. And yeah, there is also always issues of ethics, and what are they doing it for? But I think everybody's time is valuable. And more so for those whose time is actually in a way more valuable, because they're, it's day-to-day existence. As we know now with COVID in many African countries, the reasons why a lot of the lockdowns weren't as strong is because people had to go out every day to find food. They had to go out, they had to work on a daily basis, and that's where people's livelihood comes from. So I think to say you're going to go into research for however long without paying participants, and also for me, something that will really compensate for them maybe not going to work that day, or maybe not going to sell produce that day, or not going, there's many factors. But I think the participant needs to, and then it actually values them, and they're then part of the research process because their time is valued.
Okay, I am conscious of time. I also have a question from Yara, and thank you, Yara. I'm going to sort of pose that question because I think it picks up the next big topic, which is around the implications of participatory approaches and responsibilities to participants, which you've already begun to deal with. But Yara's question was, or a set of questions, but one, it was, how was virtual support perceived and accepted? Did vulnerable participants feel comfortable in a virtual environment? What was the response rate compared to face-to-face research? I think this sort of addresses the next two topics around kind of accessing participants, whether they felt comfortable. I know a little bit about what we've been dealing with in the MIG project that Felicity's working on, so I'm not going to steal her thunder, and she knows much better about it than me anyway. So we're going to again ask the four participants to address that issue, and if they can kind of wrap Yara's question into that. So I'm going to slightly change the order. I'm going to go with Melis first, if that's all right. Yeah,
we're just responding to Yara's question, right? Or
well, I mean, I think the question is about, do people? So I think the question around participatory approaches and getting people involved in the research, is it more difficult to do that if you're then trying to engage with them in a virtual way, or as opposed to being able to sort of build up trust and kind of awareness in a camp or in a village community or something? You're kind of parachuting in via video and going, great, can you work with me? Anyway. Yeah.
So yeah, I mean, in relation to Yara, that's one of the questions that we'll be answering over the next two topics actually. I mean, from my experience, we could say that like getting, sort of a virtual research done is much more difficult than getting done over, like through the face-to-face interviews or doing, like all these community-based approaches or, participatory action workshops and so on, because there is an issue of trust. Although we're working, like with the NGOs on the ground, I think the issue here is that people are less sort of willing to engage in anything that involves like a phone interviews or online interviews, for the reasons that they may not know who may appear on those calls and so on. And there's also issues in relation to, like the interpreters, sometimes, although we pay attention to making this research using the first language of the participants, the issue of, like the interpretation, like again, like it plays a role. For example, in my research in Turkey, when I'm just engaging with the Syrian, a woman, the issue of, like not being able to speak Arabic and, and being able to use that I have to use a interpreter is also, like an issue. And that's something, like you can't really do when you're doing an online research too. So I hope that sort of answers Sierra's question. But so moving to the implications, I assume of
yeah. Lots more
so,
questions coming in, but I'm going to try and feed them in at relevant points. I'll let you go, Melis.
Okay, so when we look into the implications for participatory action research, so there are a couple of points that I can mention as based on my experiences, that I think the communities sort of should be included at the onset of research, like for drafting some ground rules and, like a safeguarding measure. So that's the one thing, often safeguarding measures are important from elsewhere. And I said, like in the ethics applications, they may not be contextually relevant or requires, like discussions of input of all, like of both the communities and the NGOs that we are, like working with. But also, like doing a participatory research is important for increasing the awareness of, like people on the ground. It's in terms of, like not community-wise, but also including the local actors and the local NGOs, or also the local, community, I wouldn't say communities, but local, like governments, in terms of how we engage in such a research. Of course, here the issue of, again, like a paying back to the community comes as an important thing, like when we're working with communities, and this is also, as I said, something supported by the NGOs. So collaborating with the NGOs is important to provide, counseling or any activity that the community needs, because this is again important, because you can't just run your workshops and leave, and like leave those people, like as if you haven't provided them anything, or as if nothing happened. So, and for us, like, of course, with the COVID-19, we had some issues about, looking into or integrating the community into, like any kind of participatory action research, or because the way that Tommy and I work, that we would always do like a community based approaches and participatory arts approaches, where we will include, like the entire community as much as possible, the, like the local actors over there, the local government, local NGOs. But with COVID-19, we see that this is, like sort of turning into a more virtual environment, which we can't do actually, because in the communities that we're working with, there's no internet access, or even the, like sometimes the phone signals, you don't get phone signals. So it's not, it's basically not practical to do any kind of, participatory action research with them. So throughout this process, actually, we have more sort of postponed these kind of activities, but instead what we offer to the communities is that, like what they need, how we can support them, sort of, like trying to understand the ways, like this pandemic has further deepened inequalities that have been experiencing. So now when we go back to the, like communities, probably in September or in October, we'll be in a much better position in terms of, like addressing all those issues that they have been going through.
Thank you, Melis. I will now invite Felicity.
My opinion is that currently fieldwork as is, remote fieldwork, it's largely extractive. Like, we are taking in so much out from these people, but giving back very little. And to give credit to the project that I'm currently doing, we were able to actually bring in various stakeholders at the beginning of the project, where we had seminars with them and picked out the most important issues that they thought were important to them, and these were the focus of the guiding questions, if you may, in the tools that we are currently using. So we could say that we involve them from the onset and involve them in the research design, and the questions are very much at the backdrop of the information we got from the stakeholders at the beginning. And also currently, I think it's important that we're preparing a badged open course for policymakers, and within it is how to use evidence cafe for policy making. And I think this is quite participatory. Evidence cafes are quite participatory in the sense that they bring in various stakeholders, various policymakers, and you sit in a round table and make policies. So I think at the backdrop of all these things that we already did and we're already doing, I'd say that the project is participatory, but fieldworkers is quite extractive. So I hope that this mitigates what we did before, and what we plan to do after mitigates the extractive nature of what we are doing now.
Mm-hmm.
Yeah.
Interesting. So I think there's a long-term, short-term benefits, and how you kind of square the circle of our research feeding into a longer-term process that won't bring immediate benefits, but it's very hard to communicate that when people are desperate and up against it. So yeah, I think it's something we're all going to face or are facing. Thank you. I'm going to ask Margaret next, please. We can't hear you, Margaret. You're muted.
Sorry, I didn't unmute.
No problem.
Sorry, yeah. So in Northeast Nigeria, what I've done with the IDPs really is to look around, giving back to the community. I've actually talked about, while in my proposal, I've actually mentioned that I need to give sustainable livelihoods to the girls in this community. And so by saying sustainable livelihoods, I'm looking at training them in vocational skills, giving them lifelong learning skills and business skills. For example, these communities are into farming and agriculture. So how are you going to repackage your agricultural product so that it becomes attractive to people outside your community? So those are the kind of trainings we're giving to the girls in this community. So it's all about giving back to the community, really. Like Felicity said earlier, we're extracting a lot and giving in little. So I think it's time we begin to reverse this. So it's 50-50, you gaining, we gaining. And that way, it's, for me, that's ethical. That's ethical research. Because ethical research goes beyond the paper, the forms you fill to say you're going to get their consent, you're going to do this. It's about how you're being responsible to them, how you're going to take care of the community thereafter. How do they feel your impact thereafter? And the impact should be a sustainable one. It should be something that should be long lasting. So that when the next researcher comes, they're like, oh, the last one did this, and we're sure this one is going to do something again. So it's about being encompassing. It's collaborative. You know, because when you do it all about, I'm doing my research, I want to get something from this community, and in the end the community gets nothing, they're going to be reluctant to respond to the next researcher who knocks on their door. So we should also be conscious of that when we design our methods and approach to research. Thank you.
Thank you, Margaret. And finally, Tommy, and I've got there's a number of relevant questions coming, so if I'll feed those in a sec when Tommy's contributed.
Yeah, thank you, everyone. I think, following from what Margaret's just commented on, I think one example, and I think what we also need to be wary of the time frames that a lot of these researchers, of course there are time limits on research and research processes, but I think, for example, the funding that we're working on together with MELIS, which is from the Arts and Humanities Council, they've actually, we were successful with the grant, and they actually then gave us 18 months work of a development award to actually do this kind of, thinking about the project that we're going to do, and actually going in innovatively. How could we actually work with the communities where we work? So, for example, we're working in Nukuchingora refugee IDP settlement in Abuja in Nigeria. And what I did as we said practically when we started, we went in, we spoke to all the community leaders to make it as participatory as possible, the teachers, the health workers, the religious leaders, the community leaders, and made sure that we then, when we thought where were the gaps, even if they were not necessarily related only to the research, but where were the gaps in the IDP camp? And of course there were many. There's limited health facilities, the education is very poor, although they have a school now. So we worked with the community leaders, with the teachers, even though we knew what the research was around peace education, but we knew that in order to engage the community, and we would build in a number of sustainable projects, hopefully sustainable as they can be. So, for example, we're working, there's an IDP, there's a school that was set up there, so we're working in the school training teachers on things that they've requested, you know, continuous professional education for the teachers, but also knowing that the peace education work, because it's looking at decolonialising methods, will in the long run go back to that school, and the teachers will be part of that dialogue and would then pass on that peace education knowledge to their pupils. The same with the health. Well, it's not a clinic, it's a room, but we actually are working with the health provider, who is actually just a volunteer nurse, and then also hired a community health extension worker, which we know in Northern Nigeria, that is the people who do health work, because we also know that in the long run this work will be disseminated through health education systems. So these ways, and so on with the research then started, we're looking at, we're using life stories methodologies. So that is only with a selected, like Felicity mentioned, that can be seen as very extractive, but we wanted to make sure the women felt comfortable with you know, discussing their work, their histories, and also how it would benefit not only them but their children, the communities where they've come from, etc., etc. And that opened up a lot of wounds for these women, because you know, it's IDPs. So we've also included psychosocial support for the women who've been part of the work, and this is ongoing. And this is a community where we will continually work with for the longer project. So we know we're going to be there for a reasonable amount of time, which again, for me, it brings in the whole thing of the whole issue of community engagement. And as Margaret mentioned initially, we will also be working with community-based research assistants, people who work, you know, who are constantly in the camp. So although at the moment the Nigerian curfew is only a curfew now, not a lockdown, so research assistants can go back in. And at the beginning of the COVID period, I asked immediately, what PPE do you need? We supplied PPE for the teachers, for the health worker, and all the women who have been, all the people who are then engaging with the community, with the IDP population. So they know we're there. We're not going for, we're not going just for the research and leaving. And these projects hopefully will continue, and as long as we join the research project and hopefully beyond, because as an NGO, we know that funding can also lead to other projects, can lead to other work. So that's where we're looking at the sustainability aspect of it. So I think for me, that's where I think it's, as I said, we have to look at what is traditional research and also look at research in a more long-term way. And I know we can do that with partnerships, with NGO partnerships, but also ensure that they have a long-standing relationship in the communities where they work and can continue that relationship even when the research is over. So then that community feel that they're part of the work now and in the future. Excellent.
Thank you all. So there's a number of now quite difficult questions come in. So Rui, I've got your question. I'm going to try and save it for the end because it's kind of quite a big one in terms of what do we do next kind of thing. But Esther's posed a question to Tommy, but I think it has relevance to everybody. It's really about how do you share your findings with participants you work with? You talked about decolonizing and equitable relationships, approaches, engagements. Can you do that ethically and equitably? So how do you share those findings so it's not extractive? And then there's a linked question from, I think it's Job at Wits. Thank you, Job. That if you've got a big I say big project, I know, say you've got a reasonably funded project from a donor, NGO, whatever, you can do this kind of work sometimes, but Job's asking, well, if you're kind of a lone PhD student, how feasible is it to sort of, you know, keep going back and doing all this kind of post research kind of follow up, really? I think so. There's questions about different types of research, different types of researchers, and sharing that. So I saw Melis was sort of nodding, shaking. So I'll give Melis the floor first, briefly. Thanks.
Well, thank you very much for those questions. So for the first one, for the SR's questions, what I would say is that what Tommy and I do is that we do co-analysis workshops. So once we have, you know, like collected the data, once those community workshops took place and the participatory arts research took place and so on, what we do is that once that data have been transcribed and so on, we go back to the communities and we just like give them those stories and say, you know, like what do you think this is coming out? You know, what's your interpretation of, you know, we have done this research, but what is your interpretation? So it's very important that you do these kind of a co-analysis workshops where you talk through the, you know, the process, the outputs, you know, like question of, you know, question from which university. Actually, I quite agree that yes, you need those kind of actually funds to give long-term community, you know, like sort of a long-term benefit to vulnerable communities. What I have done in one of my research, which could be helpful, is that when we didn't have so much funding and it was on higher education students, we were trying to understand how higher education students of refugees construct their pathways to you know, universities and so on, or, you know, how did they manage to go to the universities or what they got out of it. So the things that what we did at the end of this research, because we didn't have so much, you know, of course we paid for their time, but we provided them, you know, as an academic myself, you know, like I just like worked as a mentor for them. So whenever they had problem, I would be in contact with them, you know, explaining the situation, you know, this is, I mean, it was only 15 participants, so it was manageable for me. And I assume with your PhD, you'll be working, you know, probably 15, 20 participants. But, you know, even that mentoring work, someone that they can reach out to talk through is very important and precious for them.
Thank you. Again, I'm going to have one more quick response from the four. So, Margaret, is there anything we'd like to say on this topic, and then we'll move on to the next one, which I think again we've kind of begun to cover a bit.
Yeah, I'm just going to respond to the PhD student. Yeah, so to be honest, the way we as researchers think outside the box to develop our research designs and all that, we should also think outside the box in how we can give back to the community. Yeah, so sometimes it's not about the money or what you put, it's about how you can conceive an idea that's going to work for that community. Like Melis said, you could actually do a free 1-hour teaching in a community school. It's going to be appreciated, really. You could do a community service, something that's going to be felt in the community even when you've left. So if you don't have the finances to actually do something that's more sustainable in our language, you should actually do something that is felt by the community. You could do 1-hour community service, like I said, once a week, of community teaching, like a volunteer teacher, going to and do something that's going to be felt in that community. That way you're leaving something back for the community you've researched. So I think that should respond to your concern. And then for the IDPs in Kebbi State, not IDPs now, I had a participatory research with women in Northwest Nigeria. And what I did really was that I brought them in to the community center where they met with the local government chairman, they met with key stakeholders in the community, and they were able to disseminate their findings. So what they did was that they actually did some photo voice pictures, they did short videos, and they did it like a presentation. And that way the community leaders and the stakeholders felt what the women needed. And I think following up, they built a community center for the women because they actually understood where their stories were coming from. So it's not about me writing up the document and submitting. They're not going to be reading it anytime soon. But when they feel the participants actually disseminate their own findings in their own language, in their own picture, in the way that they understand it much better, you find out that something becomes effective immediately. Yeah, okay. Thank you.
Thank you. I think I'm picking up itching to jump in, so I'm going to give you.
No, yeah, just following that question regarding the methods and the decolonizing methods. I think for me that it goes back to the the context of where you are. And I think we're, as researchers, we also have to know that many people are working in these contexts and have been working in these contexts. And one thing I do find is dissemination of research is always seen as an add-on. You know, it's that, for me, it has to be embedded at the beginning. For example, looking at which NGOs or which activists are working on health or education, so you can then engage with them at the beginning, even if it's not your main partner, but then you can then engage with them. These are our findings from this particular marginalized group or this particular refugee settlement or IDP settlement, and then work with them in a collaborative way, even in terms of policy, you know, and then that would be a sustainable way, which could continue the work after the research has been completed. There's so many people who do research and then leave and never look back in terms of has it impacted policy? Has it been linked into any kind of policy discussion? And I think that is actually that what needs to be the number one thought. And I think now with a lot of grants, research grants and activist people are coming together to do that, because actually money is becoming tighter, so people have to work in a more collaborative way. And I think this will ensure that findings are disseminated for the research that you try and tackle in the long run. Okay,
thanks a lot. I am aware of a really interesting question around quants methods and using mobile apps that may generate data that is not people not given permission for. So I'm going to feed those into the next discussion. I want to move it on a little bit. So we've touched upon accessing participants a bit, and people have talked about the process and the long-term engagement. I think we're just going to have a maybe slightly shorter period now, so we've got time for I think the very important final topic around gender. So if the four of you could say something briefly in order around the question of accessing participants. I think from the notes we discussed the questions about, you know, how do you do that on online platforms? Do different groups respond differently? If so, why? And what are the challenges of that kind of stuff? So I'm going to ask Felicity to kick us off on this topic. Thanks, Felicity.
Oh, thank you, Giles. I can say that it has been extremely difficult reaching participants. Calls have gone unanswered, emails not replied, messages, blue ticks, and we've had to improvise as regards access. I mean, like, personal networks have proved very important as regards reaching these respondents, because you need that I don't want to say gatekeeper, but that person who knows the respondent and who's trusted by the respondent, right? Because people are very skeptical, as we already discussed. People are willing to talk to somebody they know personally, given that somebody they've been introduced to by someone they trust. So we've as mentioned, for the MIAG project, we've had to use a lot of personal networks, organizations we've worked with before to help us reach some of the respondents. But it's important to mention that this has been very varied. I mean, like, we're looking at British nationals, Indian nationals, we're looking at Chinese nationals, East Africans, Nigerians, and Nigerians, Ugandans, and Tanzanians, and there's a varied response. I mean, with the Brits, it's very easy reaching these people. With the Indians, relatively easy, not so easy for the Chinese. And because of this whole COVID situation, there's a lot of trust, and they don't like phone interviews. They don't like being recorded. There's that fear, lack of trust. So they'll tell you, I want a one-on-one interview, right? Or face-to-face interview, which is impossible at the moment, which means that we can't interview this group of people, right? And it's extremely difficult reaching traders, small petty traders embedded in the informal sector, because you can't talk to them during the day, because this is the time they have customers, they're dealing with customers. And I found myself having to interview people in the evening at night from 7, because during the day they'll tell you, I'm too busy, I'm dealing with customers. Yes, I have few customers, but I cannot risk moving away from my shop. I cannot risk moving away from my stall in case I miss a customer. So this is some of the challenges we've faced, at least I've faced. And of course, I'd say that one advantage that I've had with remote interviewing and access is that I'm getting more time to speak with these people. I mean, it's off the normal working hours. They tell me I can only talk to you at 7, but when I talk to them at 7, I get more time. I can probe. It's unlike interviewing them in person in their stalls, where there's a lot of interruptions, where there's a lot of, okay, let me handle this customer and come back, where they're in a hurry to move to the next customer. So it's kind of a double-edged, I'd say in my experience, it's been very double-edged, where yes, it's hard accessing these people, the times you have to talk to them off normal working hours, but when you do actually get to them, they give you a lot of information and a lot of time. Thank you.
Thanks a lot, Felicity. Melis, would you like to say anything?
Mm-hmm. So one of the issues that I would want to raise in relation to, doing research, at this time, like in the middle of pandemic and so on, and especially I know that many people have picked up doing either phone interviews and online interviews. I really want to ask the questions that are really necessary, because drawing on my experiences, there are 2 implications for this. So in a research that we completed around mid-April, which was actually looking into, we were supposed to do, a face-to-face interviews with undocumented African migrants. And, this is quite a sensitive sort of a topic, and they're already, feeling vulnerable, and, it's already very difficult to, reach out to them. And doing the phone interviews actually makes that process quite difficult, because they don't know who they will be talking to. And most of the time, the way that, we approach them, or the way that we do interviews, is to our NGO partners, and our NGO partners will always be present there. But in a phone interview, it increases their vulnerability, and it increases the risks of, and the sort of a trust. They don't know whether they're talking, I don't know, to a police, or to a researcher, or to an NGO worker. So this is one of the reasons. Do you really need to do this interview? The second issue is more about speaking to, the gender dimensions of it. So again, in one of our research is based on doing just face-to-face interviews with women to understand the ways that they can contribute to, they can be, peace builders in their communities. But, when you are doing phone interviews, actually you have to consider that most of the women refugees are living in extended families, sharing one room with 5 or 6 other people, and that phone might not be always the personal property of that woman, and might be a phone that being used by all the members of the family, and that woman may not have the the privacy to talk to you, or the things that they may say to you. I mean, if they're under I don't know, if they are facing sexual assault, or if there's anything that's threatening their well-being, they're unlikely to say it to you when her husband's around, or her grandparents is around, or her a parents-in-law around. So these are the issues that you really need to consider. But on the other hand, it's really important that to understand how this process also is affecting them, how the COVID-19 or the pandemic, or not being able to go out, lockdown has had sort of impact on them, or affected their well-being or economic situations, to be able to help out and devise policies, or find immediate humanitarian reliefs. But there's also we need to make that choice very clear. Is it really necessary that we do these interviews? Because that has a lot of issues in relation to the data that you will be getting, and also the issues of security and risk.
Okay. Thanks, Melissa. I can see from the notes we discussed, Margaret, you had some experience of you mentioned at the start, these community-based RAs.
Yeah. First of all, from my experience, what I use is community-based research assistants, really. And like I said, I have to buy their mobile data to gain access for them to do that. And then I realized that the use of WhatsApp, it's very useful in the communities I research, because WhatsApp is generally designed to be a channel of private and informal communication. So you find out that it allows you to approach the participant in a very informal, chatty, friendly way, and then it allows them open up. It encourages them to actually open a communication channel with you. But there's this risk of self-censorship. They want to tell you what they want to tell you. And so how do you mitigate that risk? it's usually what I do is I try to open up the conversation with them at intervals. I go back to ask the question again that I've gotten a response to, and I follow the thread to ensure that it's consistent with what they've done. And then the advantage of WhatsApp, really, apart from it being an informal network, because due to the COVID-19 lockdown, everybody's like being skeptical. Who am I speaking to? What are they gaining from me and all that? But because WhatsApp is designed to be a friendly, informal app, it makes it easier for you to gain access to those participants. And then there's this data accuracy I've noticed with WhatsApp use, because they tell you the information immediately it's happened, so it's not distorted. Really, the information you get is almost close to reality. So if something has happened to a participant and they quickly either take a picture or do a voice note or do a chat to you, you're getting close to reality what has happened. But the disadvantage is actually the issue of security. You can't, the platform provider the platform was not designed for research. So there's this question of the WhatsApp in terms of participants, their data protection. Is it protected? Because when they signed up to the WhatsApp app, they gave their right to the so that's also the big issue there, the data protection. But apart from that, the use of CRBAs has actually been very effective for me, because they are community members, and then they go into the community to interview the participants, of course maintaining the social distancing rule. Okay. Thank you.
Thank you. I've got a question I'm going to feed into that, but I'll just give Tommy a couple of minutes to chip in, and then we'll have some questions quickly.
Yeah, I think just following that, I think just in terms of accessing, I think it really, and this particular time, it depends on the context you're in. As I said, in Abuja at the moment, we have gone back just today, back to face-to-face with all social protection, PPE, sanitizers in place. So we've allowed that to happen, and we've given enough time to see how things were going to be, how things are in Abuja. In Uganda, that's not the case, because we work in a rural settlement where actually there's been a lot more implications of COVID in terms of, for example, food distribution has been cut by a third to refugees who live in Oruchinga refugee settlement. So we really have to kind of look at the realities on the ground of working in that particular community, and what the difficulties will be, and logistically in terms of it being in a rural area. Following from that, I do think WhatsApp is an option for some, but I still think we have to look at the access to technology, and we'll discuss that in the next question for women especially. I do think WhatsApp is still it's not generally used by everyone. Doesn't have smartphones, for example. Literacy levels will limit some people accessing WhatsApp in terms of language. Which language are we using? For the participants, and I do agree data protection is a major factor. I think it depends on where you are in the research process. I think if you've got an ongoing relationship in the particular setting, then you can continue liaising with especially your community-based research assistants, and making sure people know that you're coming back, you're engaged. So then the pressure will be more on going back to the funder to say, actually, this is not realistic right now. We can't do it. We want to do it face to face, but we need to know it's safe for our participants, and it's safe for the team, basically. However you disseminate, and I think sometimes that pushback is needed, because let's be honest, some of this research, these deadlines are not life or death. COVID camp is life or death for many people in many situations. So I think we have to go back, and as I said, look, really be more forthright as practitioners, researchers to the funder, and just be realistic in what we're dealing with, especially on the African continent, where we don't know where the wave will come, how it will come. Touch wood, things are looking okay at the moment. We don't know how long that will be. So I think we have to be realistic in terms of accessing the participants, and maybe redrafting the actual research design and rethinking it with as much with the community at the forefront of those decisions.
Okay, thank you. I've got a couple of, I think, pertinent questions. One's slightly around data protection. So It's come through as anonymous, so I can't say who that was from. But there was a question about, are any of you using kind of apps such, some of the apps and things like Facebook that would then also harvest information and data, and what are the kind of ethical and implications of that, and what can we do to kind of mitigate that? And also, if it's the same anonymous, I'm not sure. Kind of another question about, all of us have been talking, all of you have been talking about more qualitative approaches, whether it's arts-based, interviewing or whatever. Has anybody tried to sort of think about quantitative methods for in this time, about other ways of approaching some of these issues from different data sources? So that's the first question. I'm going to quit, and if you could just, I'm not going to say, I think I'll just pick a couple of you. I think we're getting to time. I do want to give the last issue some time, so if you could, I'm going to see if Felicity has got any comments on that.
Okay, so we've tried conducting, because the project is kind of a mixed method, has a mixed method approach to data collection, and we've tried collecting quantitative data using Kobo Connect. It's an app, it's a software, and what we're currently doing is carrying out the survey remotely. We are phoning these people and actually just ticking the boxes. But we realize that it's more of an interview, because I mean, like, when you're in a remote, when you're conducting this kind of when you're collecting this kind of data remotely, you find the respondent digressing and talking and not really ticking the boxes. So what I've done, I found myself doing, is actually recording the survey question, because there's so much depth that you get from doing such a collecting survey data remotely than you would in person. Because I mean, like, if it's in person, you just ticking boxes using the app, ticking boxes, but now people are talking. So I think there's an advantage to it, because with remote interviewing, you're not only ticking boxes, but you're actually talking to that person. They're giving you different perspectives that can also feed into the quantitative tools. Yeah, so far it's not been a challenge. I think it's doable, but we are thinking of moving now to the field, because we're not getting as many people willing to participate in and this is a challenge. You're not getting enough people willing to take part in the survey remotely. So we are forced to now go to the markets, go to the streets, basically, where we can find these people. So it's upon us now to find ways of protecting ourselves and protecting the respondents. Thank you.
Okay, thank you. I've got a further question from Simone. So, I mean, Felicity in particular, but then the question is to everybody, highlighted the challenge of sort of questions of ethnicity and gender, and we're obviously going to come on to gender, about being able to access certain nationalities or certain groups more easily than others. And obviously that then has an implication for the sort of sampling in a way. I mean, how do you, so if some are more difficult to access than other groups, then do you ignore those, the difficult to reach groups, but then they may well be the ones that really need to sort of have their voices heard in some way? So how do you, any tips on how to overcome those issues of sort of a kind of sampling frame, but also accessing those people in a way, if the question's clear?
Oh. Okay, so what we decided, because it was so hard to access, for example, the East Africans, because they're embedded in the informal sector, was to start with the people we could access. I mean, like, we started with Brits, started with the Indians, we started with locals, Kenyans, for example. And I've had this kind of, based on the people we are talking to, the Kenyans we are talking to, we are having a kind of snowball ripple effect, and they're introducing us to these people in the informal sector. But also, we realized that with the Chinese, it's been extremely difficult. Like, so far, we've had over 50 interviews with different nationalities, but no one Chinese person has agreed to be interviewed. With the East Africans, as I've said, given that we couldn't access them remotely, we are now forced to go and find them in the field in person. So I think remote interviews can only work to a certain extent. And not very much with certain nationalities. Yeah.
Thank you. I'm aware we've now only got about 15 minutes left. So the final big topic, which we've again touched on in different ways, was around the gender dimensions of researching remotely. So I'm going to turn to Melis first, if she could say something about that.
Yeah, thank you, Giles. So during this lockdown, I think one thing we can all agree is that violence against women has increased. You know, wherever you are, you will see the reports or the newspapers, saying that the woman has been now experiencing more than any kind of physical, sexual, or economic violence that they have ever. And I think it's just like this is also valid for the vulnerable or marginalized, or how you call it, like mobile populations or local populations as well. So it's really important to like sort of understand this. Like doing. I mean, if you are going to do any research during lockdown, this would be one of the reasons why you should be doing research. But then on the other hand, if you're doing phone interviews, I just like discussed previously, is that these women are less likely to talk to you, and share any kind of this kind of experience when their husbands or their, the male members of the family are around them. So it is really important that as we ease the lockdowns, you just like provide safe spaces for these women where you can take them out from their house, and if you're doing such a research, and interview them, and provide any legal and like a psychological counseling and support if you can. And the other issue is that like the gender dimensions of doing research. I'm just now going to talk mostly about interviewing perspective, but because that's also an issue that comes up in our community approaches as well, is women are less likely to be talking. So women are less likely to be expressing themselves in the in the presence of men. That's why, for instance, in Abuja, we're doing only women and men, sort of men only and women only workshops to give women more space to talk about the issues that they want to raise. And also the other thing is the language. So the women are less likely to speak the language of the country that they are living in. This is because they are sort of, they're not as, they are socializing. I'm not saying that they're not socializing, but the public sphere is much more limited. Their access to public sphere is much more limited than their male counterparts, because if they're not especially involved in any kind of a labor force or participating in labor force. So it's really important that you provide, either researchers of the same sex, because they are also, again, they might be less likely to speaking to someone, like a male researcher or a male interpreter, or the same sex interpreters are available doing any kind of research for them. And the final issue that we have also identified is the gender norm. So in some communities, just working only with women may agonize men, may, some sort of raise conflict. Oh, why you're only working with women, but not with men? So it's really important that at that point you also include the male members of the family to avoid any kind of this kind of conflict among the, like family members, but also within the community too.
Yeah, very interesting. I think questions there about gender of researchers and questions of violence as well. So I'm going to ask if Tommy wanted to go next for a couple of minutes.
Yeah, I think, following on from Melis, I think those are good. I think as with the research design, as I've mentioned before, I think to really incorporate the kind of gendered dynamic of research, you have to really know the context of the environment you're working in, and the gender dynamics within that. In some instances, you will have to speak to community leaders who are usually some do have both, but they tend to be men, to explain the research. And in areas where it is very sensitive, sometimes that could have to be cloaked in other areas. For example, a lot of work that I've worked on early marriage, child marriage in northern Nigeria, and we've then linked that into the health of young women. To kind of, make it a kind of holistic research, because certain subjects will be very sensitive in those particular conservative or, small c environments. So I think the context is very important to really engage, and also really engage with community leaders, especially if they are women. That's the most advantageous way of working, and really engaging them at the initial outlet. But I think we have to be realistic about the gendered inequalities in many places where we're working, and take those into account. For example, even in Uganda, which hasn't got the gender inequalities in terms of education, for example, there are still issues of women speaking out less, as Melly said, in front of men. So not all research spaces allow separate, sessions. So how do you encourage women to speak up? How do you engage with them and their own particular issues? And so I think it's just a very, you have to have that lens on. I'm not saying we as all the participants here are women. Maybe we have that lens on automatically, but I think it warrants that way of thinking beyond the kind of traditional mechanisms, and also the research that you're using. For example, the arts-based work that we're developing in both Uganda and Nigeria, which has used photo voice. Women found that very engaging because it's very practical. They liked that, and then they could really be part. But they felt that they could be part of that rather than feeling more marginalised if it was a very much talking kind of research method. So I think the research methods also will align in terms of how you engage women, and also I would say looking at where you really access women in a more diverse way. Sometimes only going to the community leaders, you will narrow the possible sample and the participants that you can engage. But the difficulties are there, but you have to overcome them to ensure that the gender and both ways is incorporated into the research. Okay. I would say.
Fantastic. Margaret, would you like to add some thoughts on top of that? If you could just keep anything new that you want to say rather than repeat anything that's already been said, it would be great.
I think that's about what I would have said. Designing methodologies that actually sit within women's context, that's a plus for looking at the gender dimensions in research remitedly. Yeah. That's, I think that's about, yeah.
Is it okay? And Felicity, you had some thoughts on accessing female participants in the MIAG work, yeah? You're muted. Okay, yep. You're back.
Yep. I think it's been relatively hard, of course, scheduling interviews with women compared to men, and of course, there's the issue of taking care of my children. Can we have this interview at night? Because this is when they are all asleep. I'm working remotely and doing all this. And I've had to adapt myself to this situation and say, I can only talk to you over the weekend. It's when I'm alone. So I mean, like, there's that agency where they can decide when and how they want to be interviewed. And I've given them this space to be able to choose when and how, right? A good number of refugee women in my own personal research, of course, share phones, has already been mentioned. And this, of course, has an implication. I've had instances where both spouses join the call. Like, I could hear the woman waiting to get some feedback from the husband. And of course, for me, the question was, is this data valid? Right? Mm-hmm. Is this data that I can use for this research? Should I include it as one of the interviews I've conducted, or should I go back and conduct this interview again where this person that I'm interviewing is alone, right? So of course, currently I have not discussed this with the principal investigators and the larger team, but there's the question mark of the validity of this data, where you have a spouse in place helping the respondent answer the questions you're asking, of course. And I think there's a lot of questions. I think for me, there's a lot of questions on the validity of such data. Mm-hmm. Yeah. Mm-hmm. Thank you.
Fantastic. I'm just going to feed in one question that came in early from Rui as a sort of possible way of sort of trying to tie things up. Was, what happens when people say no to doing the research? When we don't get these people and communities wanting to participate in the research. Have we had to people had to change the direction of the research? And Rui asked a kind of quite provocative question then, you know, what's the best thing that we should be researching in this time then, if, you know, we set out with these agendas, and, you know, this now has come from kind of not left field exactly, people have been predicting pandemics for years, but, you know, now this is, should we be shifting our research? You know, I think Felicity said we've tried to stick to our original research, but kind of factor in the difference that COVID has made to the kind of questions we were going to ask anyway. But is that the responsible thing to do, or should we just say no, let's kind of, and the research councils are asking us at the moment, should we, you know, do you want to shift your research focus? So, you know, is what we set out to do still relevant, and if so, should we, and, you know, on what role, I guess, does gender, you know, are there any gender dimensions to that? Have engagements thus far around gender said, well, oh my God, we're looking at the completely wrong thing here, or yeah, and as a sort of just way of trying to tie everything off. So you've got about 30 seconds each, I think, to try and do that. So I will go to Tommy first.
Merlis had her hand up. I was distracted.
Oh, sorry.
No, it's okay. No, I think what you think. Yeah, I said that at the beginning. I think we're at this time we need to make sure, you know, we're clear with Funda what the realities are, where the context we're working, and if, you know, even if it's not changing the whole research design, because we know that can be a long process, is really bringing in the effects of COVID for the populations that we're working with, and ensuring that they know the realities, because I think sometimes we also, you know, we don't really tell the realities in order to keep the money and to keep the research going. So I think that, and then if and we don't know how things will change or develop as the year goes by, and I think then we really need to say, okay, this particular piece of research is not as relevant now. We want to look at this first, and then maybe come back to the original research at a later date. I think that is also a possibility now.
Melis?
Hi, so yes, I agree with most of the points that Tommy also raised, but there are two issues that I want to sort of quickly unpack. Is that when we're writing these bids or grant applications, actually we strategically, you know, like employ or sort of approach our partners, and we just like make sure that, you know, we're working with the people, the local actors, NGOs who have built that trust with the communities, and so that they will be, you know, like engaged in the work. And most of the time, you know, like this collaboration is just like works like, you know, like in where the NGOs and the local partners, you know, like we're collaborating with them, but they're at the front line delivering and, you know, like engaging with communities. So this is it's really important that we're working with the right people who have the buy-in support of the communities. And the other issue is that I want to, you know, maybe it just also speaks to the last theme, is the gender sensitive budgeting. So most of the time, I know it's very difficult to, you know, like employ participants, but it's very difficult to employ, you know, like especially particularly women, you know, like a participants in a context of, you know, like a conflict and vulnerability. So all the way through, Tommy and I have always been very sensitive about creating this gender sensitive budgeting where we allocate some of the costs for childcare and so on, because when those people, when especially women, you know, like and allocate their time for your research or join these workshops, that doesn't necessarily mean that they don't have to go back to their communities, look after children. You know, that you need to provide that kind of a space for them where, you know, like at least, you know, provide childcare where they're engaging with us, and, you know, like any kind of I don't know, extra support that you could give them so that they can, you know, they have the equal opportunities as the men to participate meaningfully in that research.
Good, thank you. And Felicity, very briefly.
Oh, I think for us personally, we've had to set aside some people, like some nationalities that we're interviewing, given that they're in a more precarious situation than others, like start with those that we feel are more kind of privileged in this sense, and give these other ones who are very, very affected by COVID some space to actually recover. And now that the country is recovering, it's when we are reaching out to them more. And with our mixed method approach, we found that it was easier to conduct KIIs fast. Ideally, in most cases, you have the survey being carried out first before the KII is the qual part, or rather them going concurrently. But because most of these traders that we are targeting with the quantitative that we're targeting with the quantitative data are in the more precarious situations. We thought to put aside this first and really deal with those who are more privileged. I think this is in line with taking care, or really putting the feelings of the people we are trying to interview first. Thank you.
Thank you. And finally, Margaret, you kicked us off, so you're going to finish this off as well. So
yeah, I'm going to conclude with my initial saying that the health and the well-being of the participants should be priority. It should override your timelines, your deadlines, and then you should also ensure that to mitigate the risk that researching remotely should be done. Should it be done at all? If it's not safe to do, then there's no point carrying on, because in the end, you're putting someone at risk. And then ethical guidelines must be upheld, whether we like it or not. So we could go back and redesign our approaches to consider the well-being of our participants. And then, of course, I talked about the use of community-based researchers. They're actually very valuable in research such as this, because they are the ones who are local, who understand the local dynamics, the local context, and they could ask questions that are sensitive to the feelings, the experiences of the locals. So do not underestimate their value in research such as this. Yeah, thank you.
Thank you so much. Well, thanks to everybody. I think we could probably go on, but we better move ahead and everybody get off to do other things. But I just wanted to thank our 4 speakers today. I've been making lots of notes, and the things I'm now going to go back to my research projects and think about again. So that's a good outcome for me. But obviously this will be going live. The recording will go up onto the website that Heidi will let you know about that. Obviously, if you've got any specific questions that you want to follow up with our speakers, I guess their access details are available, or go through myself or Heidi, I guess, and we can pass those on if they're happy to do that. Just wishes me to say thank you again to Heidi for organising all of this, and for you for listening. And there will be another of these, I think, later in the summer, so we will contact you with the details of that. And yeah, stay safe, stay well, and good luck with everything. Cheers then. Bye bye.